Welcome to today's lecture on respiratory failure. We will explore the causes, symptoms, and treatment of conditions such as ARDS and COPD exacerbation-induced respiratory failure. Let's dive into the complexities of this topic. In this section, we will focus on acute respiratory distress syndrome, ARDS, a critical condition involving severe respiratory failure. We will cover its causes, how it affects the lungs, and the symptoms commonly seen. We will also discuss the management approaches, including how to provide proper ventilation and support. Moving on, we will focus on the exacerbation of COPD as a common cause of respiratory failure. We will explore the unique features of this condition, such as persistent airway obstruction, impaired gas exchange due to emphysematous changes, and the risk of hypercapnic respiratory failure. We will discuss the management strategies, which involve a combination of bronchodilators, systemic corticosteroids, and oxygen therapy to achieve adequate oxygenation while avoiding the risks of carbon dioxide retention. Next, we will explore the various types of interstitial lung diseases and how they can lead to respiratory failure. We will discuss the underlying pathophysiology, which involves distorted lung architecture and impaired oxygen diffusion across the alveolar capillary membrane. We will touch upon the clinical presentation, including progressive dyspnea and restrictive spirometry patterns. Additionally, we will discuss the management strategies, which primarily aim at treating the underlying interstitial lung disease and optimizing oxygenation and lung function. Now, let's shift our focus to the rationale, benefits, and techniques of placing patients with ARDS in the prone position. We will explore the physiological mechanisms behind the improved oxygenation and lung recruitment observed with prone positioning. We will discuss the evidence supporting its use, the appropriate patient selection criteria, and the potential complications and challenges associated with this intervention. In this section, we will investigate the use of non-invasive ventilation modalities, such as BiPAP, B-level positive airway pressure, and CPAP, continuous positive airway pressure, as a treatment option for patients with hypercapnic respiratory failure. We will discuss the mechanism of action, patient selection criteria, and the benefits of this approach in terms of avoiding intubation and invasive mechanical ventilation. We will also touch upon the monitoring and troubleshooting aspects of non-invasive ventilation. Moving forward, we will delve into the mechanisms and advantages of high-flow nasal cannula therapy as a non-invasive method for delivering heated and humidified oxygen. We will explore its role in improving oxygenation, reducing work of breathing, and minimizing discomfort, particularly in patients with respiratory failure. Additionally, we will discuss the indications, patient selection criteria, and potential limitations of this therapy. Now, let us analyze the pathophysiology, diagnostic considerations, and management strategies for respiratory failure resulting from pulmonary embolism. We will delve into the various mechanisms by which a pulmonary embolism can cause acute respiratory failure, such as increased pulmonary vascular resistance and ventilation perfusion mismatch. We will discuss the diagnostic workup, including imaging modalities and biomarkers, as well as the importance of prompt anticoagulation therapy and potential interventions, such as embolectomy or thrombolysis, in selected cases. Shifting our focus to postoperative respiratory failure, we will investigate the risk factors, prevention, and management strategies for this condition. We will explore the importance of early recognition of respiratory complications, including atelectasis, pneumonia, and acute respiratory distress syndrome. We will discuss perioperative strategies aimed at reducing the risk of postoperative respiratory failure, such as lung protective ventilation, early mobilization, and chest physiotherapy. Additionally, we will touch upon the potential complications that can arise and the corresponding interventions to prevent further deterioration. In this section, we will assess the impact of neuromuscular disorders on respiratory function, focusing on conditions such as muscular dystrophy, amyotrophic lateral sclerosis, ALS, and myasthenia gravis. We will discuss the underlying pathophysiology, which involves progressive muscle weakness and impaired respiratory muscle function. We will explore the importance of early intervention, including non-invasive ventilation, cough assist devices, and timely referral for consideration of tracheostomy. Next, we will examine the causes of persistent and challenging to treat hypoxemia and respiratory failure. We will explore the various etiologies, such as severe ARDS, pulmonary fibrosis, and refractory shunt physiology. We will discuss advanced therapies and interventions, including extracorporeal membrane oxygenation, ECMO, prone positioning, and inhaled vasodilators, aiming to improve oxygenation and optimize patient outcomes. Shedding light on another important aspect of respiratory failure management, we will focus on ventilator-associated pneumonia, VAP, in patients requiring mechanical ventilation. We will discuss the risk factors contributing to the development of VAP, such as endotracheal intubation, prolonged mechanical ventilation, and impaired host defenses. We will explore preventive strategies, including proper hand hygiene, oral care, and the use of selective digestive decontamination. Moreover, we will discuss the diagnostic criteria, appropriate antimicrobial therapy, and potential complications associated with VAP. Finally, we will conclude our discussion by focusing on the principles, indications, complications, and outcomes of ECMO, an advanced technique used in cases of severe respiratory failure when conventional ventilation strategies fail. We will delve into the various ECMO configurations, such as veno-venous and veno-arterial, and discuss the patient selection criteria, cannulation techniques, and management strategies associated with ECMO support. Furthermore, we will touch upon the potential complications and challenges faced during ECMO treatment. In conclusion, respiratory failure is a complex condition with various causes. Understanding its pathophysiology, clinical presentation, and management strategies is crucial for diagnosing and treating patients effectively. Early recognition, timely interventions, and a multidisciplinary approach are essential for optimal outcomes. Thank you for watching.